Good morning to all. So today we can discuss about fibrinolytics. So from the name itself we can understand what is fibrinolytics. So fibrinolytics, these are the drugs which can dissolve the clots in blood vessels. That is the meaning of fibrinolytics. These drugs can dissolve the clots which is present in the blood vessels. So then what is the mechanism? How these fibrinolytics are acting? So actually these fibrinolytics, it can activate the natural fibrinolytic system. So that is the mechanism. It activating the natural fibrinolytic system. Then what about natural fibrinolytic system? So in natural fibrinolytic system, at the site of injury, initially there will be a hemostatic plug of platelets are formed. Then this hemostatic plug of platelets are reinforced by fibrin deposition that leads to the formation of a clot. So that happening during a that happens during an injury. So while healing, so initially there will be a formation of hemostatic plug of platelets, then that is reinforced by fibrin deposition that leads to a clot formation. So this fibrin deposition is very important for the clot formation, and fibrin deposition gives some rigidity to the clot formation. So for dissolving this clot, we are trying to degrade this fibrin. By degrading this fibrin, we can get dissolving, we can dissolve the clot. So that is the main aim. So we are trying to degrade the fibrin. By degrading fibrin, we can dissolve the clot. That is the actual mechanism. Then how we can degrade the fibrin? So for degrading fibrin, there is an enzyme or there is a protein like plasminogen. The problem regarding plasminogen, this is an inactive enzyme. So this inactive plasminogen should be converted to active plasmin. Then only this plasmin can degrade the fibrin into fibrin degradation products. So that point is very important. So actually there is an enzyme or protein that is plasminogen, but plasminogen fails to degrade fibrin into fibrin degradation products because plasminogen is an inactive enzyme. So we have to convert plasminogen into active plasmin. So for this conversion, we can use some medicines. These medicines are known as fibrinolytics. So what is fibrinolytics? Fibrinolytics are the drugs which can convert inactive plasminogen to active plasmin. Then by this mechanism, this fibrin may get degraded. So that is the actual mechanism of fibrinolytics. So this is regarding fibrinolytics introduction. So what is fibrinolytics? Fibrinolytics means these are the drugs which can dissolve the clots which is present in the blood vessels. That is fibrinolytics. Then what is the mechanism of fibrinolytics? This can activate the natural fibrinolytic system. By activating natural fibrinolytic system, these drugs can perform their function. Then what happens during natural fibrinolytic system? So there is initially there will be a formation of hemostatic plug of platelets at the site of injury. Then that is get reinforced by fibrin deposition to form a clot, and this fibrin gives the rigidity to the clot. So we are trying to degrade this fibrin. Then how we can degrade the fibrin? For degrading fibrin, we should have an active enzyme like plasmin. By the help of plasmin, we can degrade the fibrin into fibrin degradation products. But there is a problem. This plasminogen enzyme is there, but this plasminogen is in an inactive state. So active form of plasminogen is plasmin. So we have to convert inactive plasminogen to active plasmin. For that we are using this fibrinolytics. So fibrinolytics are the drugs which can convert inactive plasminogen to active plasmin. That is the main thing regarding fibrinolytics. Then we can discuss. So this is the mechanism, fibrinolytics. So this fibrinolytics can convert inactive plasminogen to active plasmin, and this active plasmin can degrade fibrin to fibrin degradation products. So that leads to the clot dissolution. Then we can discuss about example drugs, which drugs we are using as fibrinolytics. So there are two categories of medicines. One is first generation agents and second one is second generation agent. So example for first generation agents, streptokinase, urokinase. Then second generation agents examples Altiplast, Retiplast and Anistriplas. So this is regarding the classification. So 3 points we have completed. What is definition, what is fibrinolytics, second one what is the mechanism of fibrinolytics, third one classification of fibrinolytics. So 3 points we have completed. The next one we can see individual drugs. So what about streptokinase? So we are considering streptokinase, urokinase and Altiplast. So we are considering these 3 drugs. Then we are discussing the points regarding these 3 drugs. So first point is regarding their origin. So from where we can get the streptokinase? Actually streptokinase is microbial in origin. So from which microorganism it is obtained? From streptococci. So that is regarding the origin of streptokinase. It is obtained from streptococci. The next one is urokinase. Urokinase, actually this is earlier it was obtained from human urine, but now it is prepared from cultured human kidneys. That is a source of urokinase. The next drug is Altiplast. It is produced by somewhat newer technology, like recombinant DNA technology. By using recombinant DNA technology, we can produce Altiplast. So that is regarding the origin of these 3 drugs. Streptokinase is obtaining from streptococci. Urokinase is now obtained from cultured human kidney cells. Then Altiplast is produced by recombinant DNA technology. That is regarding the source. Then next we can discuss about their fibrin specificity. Which drug is showing more fibrin specificity? Actually Altiplast. It is highly fibrin specific than streptokinase and urokinase. So Altiplast shows most fibrin specificity. So Altiplast is the highest drug which shows fibrin specificity as compared with streptokinase and urokinase. Then streptokinase is the least fibrin specific drug as compared to urokinase and Altiplast. Then urokinase comes in middle. So it has more fibrin specificity than streptokinase but less fibrin specificity than Altiplast. So that is regarding their fibrin specificity. So streptokinase is the least fibrin specific. Then urokinase is producing fibrin specificity better than streptokinase and less than Altiplast. Then this Altiplast shows highest fibrin specificity. The next point we are discussing about antigenic and pyrogenic character. Then definitely in this category, so that means we are considering 3 drugs. In these 3, definitely streptokinase is from a microbial. So streptokinase is microbial in origin. So this drug definitely shows antigenic and pyrogenic character, and remaining urokinase and Altiplast, they are not showing any antigenic and pyrogenic character. So they are non-antigenic and they are non-pyrogenic. So the streptokinase is antigenic and pyrogenic. So streptokinase is only the antigenic and pyrogenic drug in this comparison. The next point we are discussing about half-life. Streptokinase shows 30 to 80 minutes half-life. Then urokinase shows 10 to 15 minutes half-life. Then Altiplast shows very short half-life, that is 4 to 8 minutes. So this is regarding their half-life. So half-life gives an indication about the duration of action. So the half-life, streptokinase is the first important, or this drug shows more half-life, but urokinase is in between. Then Altiplast shows least half-life. The next we can discuss about their destruction. So once if you are taking streptokinase, what happens? Once if you are taking streptokinase, while the administration of streptokinase, there will be a generation of antibodies. And these antibodies, why antibodies are producing this? Because they are microbial in origin. So there will be a formation of antibodies, and these antibodies formed may persist for longer period. Hence, if thrombolytics are required during that period, other drugs should be tried. That is regarding streptokinase. So if we are administering streptokinase, by administration of streptokinase, there will be a formation of antibodies, and these antibodies formed may persist for a longer period. Hence, if thrombolytics are required during that period, we should think about alternate fibrinolytics like urokinase or altiplase. Then urokinase and altiplase, these drugs are not destroyed by the antibodies. So there is no destruction by the antibodies while administration of urokinase and altiplase. Then next we can move to route of administration. Then streptokinase we can administer by IV infusion. Then regarding urokinase and altiplase, they will be administered initially as IV bolus, then followed by IV infusion. So this is regarding the way of administration. Then next we can discuss about uses. Streptokinase is used for myocardial infarction, deep vein thrombosis, pulmonary embolism. Then regarding urokinase, this is used for myocardial infarction, deep vein thrombosis and pulmonary embolism. Altiplase, it is used for myocardial infarction and pulmonary embolism. Then regarding side effects, definitely streptokinase will be producing more side effects because they are microbial in origin, so there will be chance for some hypersensitivity reaction. Then beyond hypersensitivity reaction, this will be showing hemorrhage. Then next, hypotension, arrhythmia. So these are the side effects regarding streptokinase. Then comes to urokinase, hemorrhage can occur, but hypotension and allergic phenomena are very rare. Then altiplase, hemorrhage is less, nausea, mild hypotension and fever may occur. So this is regarding various points regarding streptokinase, urokinase and altiplase. So now we can conclude this fibrinolytic system. So once again, in fibrinolytic system, first we are discussing what is definition, second one mechanism of action, third one classification. Then we are individually we are discussing few points of these three drugs, streptokinase, urokinase and altiplase. That means we are comparing streptokinase, urokinase and altiplase based on some points like side effects, uses, then origin, then half-life. Then these are some common points. We are comparing these points of these three drugs. So with this we are completing fibrinolytics.